You know how sometimes you go into a clinic or hospital and everything just flows smoothly? You feel like you're in really good hands?
Yeah, definitely. And then other times, maybe not so much. Things feel a bit chaotic, maybe confusing.
Exactly. And we all want that smooth, reliable experience, especially with health. That brings us to something that works behind the scenes, but is super important.
Right. Our listener, who's keen to really get healthcare without, drowning in technical stuff, sent over some great material on standard operating procedures, SOPs.
Ah, yes, SOPs. We've got some guides here on actually building them, why they're so critical for like meeting regulations and how they connect to good patient care.
Fundamentally, they're like the detailed instruction manuals for specific jobs in healthcare.
So our mission today, we're going to dig into these resources, pull out the key bits, and give you a clear picture of how good SOPs are made, used, and kept current. Think of it as your shortcut to getting up to speed on this.
Okay, so let's start with the basics. What is an SOP? The ICH definition calls it a detailed written set of instructions designed to achieve uniformity.
Uniformity, that sounds like the key word. Why is that so vital in a healthcare setting?
Well, the sources point to a few big reasons. First off, it ensures that patient care is consistently high quality. It shouldn't matter who's working.
Right. You want the same standard of care always. And I guess that consistency helps cut down on mistakes, especially for, risky procedures.
Precisely. Fewer errors, less risk. And when patients get that reliable care every single time, it builds a massive amount of trust.
Makes sense. What else?
Well, they also make operations more efficient. Imagine patient admissions. A clear SOP saves time, reduces confusion for staff and patients, makes sure nothing's missed.
And that efficiency, it probably saves resources, maybe even money down the line.
It often does, yeah. Plus, SOPs help teams communicate better. If everyone's using the same language, the same procedures, collaboration just works better.
Okay, so it connects different people and tasks, and you mentioned regulations before.
Huge piece. Agencies like the FDA, local authorities, they have rules. SOPs are often how healthcare places prove they're following those rules. Documented proof.
Got it. So where do we actually see these SOPs in action? The examples were pretty wide-ranging.
Oh, totally. You've got patient-focused ones.
Yeah.
Admissions, discharges, how medication is given, the initial intake process, all that stuff.
Okay, direct patient care.
Then there's safety. Big ones like infection control, hand washing, how to use PPE correctly, dispose of it, emergency plans too.
Right, critical safety steps.
And operational things. Sterilizing equipment, hugely important. How medicines are bought and stored. Booking appointments, even the steps for surgery.
Wow, okay. Even booking appointments, it covers a lot.
And don't forget admin, managing patient data securely, submitting regulatory paperwork correctly, staff training, onboarding. SOPs cover those too.
So they really are everywhere, touching almost every aspect of healthcare.
Pretty much, yeah. Which brings us to the next logical question. How do you actually create good ones?
Right, the how-to. The sources seem to agree on some core steps. What's first?
Identifying the key processes. You can't document absolutely everything at once.
Focus is key. So which ones?
The advice is focus on things critical to patient care, high-risk activities, and tasks done really frequently. Sort of map those out first. That's your foundation.
Okay, map the critical paths. Then what?
Develop a standard template for the SOP documents themselves. Consistency in the format helps a lot.
Ah, so the SOPs for different things should look similar. Makes sense. What goes in the template?
Things like a clear purpose, the scope, like who and what it applies to, maybe what it doesn't apply to, responsibilities, and then the core, the step-by-step instructions.
And the language matters, I bet.
Absolutely. Keep it simple, plain English. Avoid jargon where you can. The goal is clarity for everyone who uses it.
Makes sense. And I saw mentions of visuals, like flowcharts.
Yeah, very helpful. Flowcharts, diagrams, they can make complex steps much easier to grasp quickly. One source even talked about aiming for a specific reading level to ensure it's widely understood.
Good tip. What else belongs in that template?
Usually a header with a title, a document number, version number, references to other relevant documents or rules, definitions if needed, roles and responsibilities laid out clearly.
Okay. Appendices sometimes. Revision history. Signatures.
Exactly. Depending on the context, you might need all of those, especially the revision history and approvals in regulated areas.
Now, this next step seemed really emphasized in the materials, collaboration.
Oh, absolutely critical. You need input from the people actually doing the work. Nurses, doctors, techs, admin, staff, whoever's involved.
That the experts, the users involved, why is that so crucial?
Because they know the reality. They know what actually works, what's practical, where the potential problems are. Their feedback makes the SOP usable, not just theoretical.
Right. I saw a note about setting up SOP review circles. That sounded interesting.
Yeah, getting different disciplines together to review drafts, catches blind spots, builds buy-in. You need the team to feel ownership.
Okay, so collaborate, get feedback, then comes the actual writing. Any tips there?
Keep sentences clear, concise. Active voice usually works best. Main idea first. Be really careful with words like may, must, should. They have specific meanings.
Precision matters. Avoid ambiguity.
Definitely. And be specific. Don't just say clean the surface. Say clean the surface with X disinfectant for Y minutes. Enough detail to prevent guesswork.
Got it. Concrete details. What's the final step in development?
Testing. You absolutely have to test the draft SOP in the real world. Have the team try to follow it. See where they get stuck, what's unclear.
And then revise based on that feedback.
Exactly. It's an iterative process. Test, revise, test again if needed. That ensures it's practical before you roll it out widely.
Okay, so you've developed this great tested SOP, but that's not the end of the story, is it? Implementation is next.
Right. Having the document isn't enough. People need to know about it, understand it, and use it correctly. Training is step one.
Makes sense. What kind of training?
Thorough initial training when it's new, but also ongoing refreshers. And maybe competency checks like quizzes, simulations, or watching staff perform the task.
So confirm they actually can do it according to the SOP.
Exactly. And make sure training materials are easy to get to.
Yeah.
Then there's just access to the SOPs themselves.
Ah, right. The sources really pushed for digital, didn't they, over paper?
Strongly. Paper binders get outdated, lost, they're hard to search. Digital systems, ideally one central place, make them instantly accessible to everyone who needs them whenever they need them.
Accessibility plus understanding, staff need to actually internalize it.
Yes. And SOPs aren't static. They need looking after. Regular reviews are essential.
How regular?
Depends, but maybe annually? Or sooner if something changes, a procedure, a regulation, new equipment. You need a schedule.
Keep them current.
Yes.
And monitor things like error rates.
Yeah, look at performance data.
Yep.
Are errors going down? Is patient satisfaction improving? Get feedback from the team too. Are there parts of the SOP that are awkward or outdated?
Treat them like living documents, always open to improvement.
Precisely. And that brings in version control.
Yeah.
Super important, especially in regulated fields.
Meaning tracking the changes?
Exactly. Knowing which version is current, what changed from the last one, who approved it, when, it's crucial for audits and just ensuring everyone's using the right procedure.
Okay, so development, implementation, training, maintenance, it's quite a cycle. But things can still go wrong, right? What are the common hurdles?
Oh, definitely. The sources listed quite a few. A big one we touched on, inaccessibility. If staff can't easily find the SOP, they won't use it.
Solution: digitize and centralize.
Right. Another is unsocialized SOPs. They exist, but maybe staff weren't involved, don't buy in, or just aren't consistently using them.
So communication and reinforcement are key there. Maybe those SOP champions you mentioned.
Exactly. Champions. Clear communication about the why, maybe even audits or checks to ensure they're being followed.
What about poorly written ones?
Big problem. Unclear, jargon-filled, outdated. Leads to variation and mistakes. The fix is clear writing, simple language involving experts, maybe even professional editing for critical ones.
And the maintenance piece, just letting them get old?
Yep, lack of updates. Procedures change, but the SOP doesn't. You need that review cycle, careful documentation of changes, clear formatting.
What if the SOP is great, but the training wasn't enough?
Then it's useless, right? Need solid initial and ongoing training, plus those competency checks we talked about.
Okay. Any others? Scope issues?
Yeah, if the SOP isn't clear on exactly what it covers or the instructions are too vague, it needs a clear purpose statement and specific actionable steps.
And relying too much on just text.
Could be hard to follow. Not using flowcharts, diagrams, pictures, even videos were helpful. Visuals make a huge difference for understanding complex workflows.
That makes sense. What about SOPs written by consultants without enough input from staff?
Can lead to impractical procedures that don't fit the real workflow. Always involve the end users.
Fragmented data, what does that mean?
If the info needed to write a good SOP is scattered all over, hard to access, it makes standardization tough. Get your data organized first.
And sticking to paper instead of digital.
Limits access, makes updates harder to communicate. Digital is really the way to go now.
One more I saw mentioned, losing knowledge when experienced staff leave.
Yeah, not capturing their expertise. Encourage experienced folks to help document best practices, lessons learned. Institutional knowledge is valuable.
And finally, having too many versions floating around.
Chaos leads to inconsistency. Need one official, current version, clear ownership for updates. Keep it simple.
Wow, okay. Lots of potential pitfalls, but also clear solutions. Now, let's circle back to compliance. How exactly do SOPs help meet those legal and regulatory demands?
Fundamentally, consistency reduces risk. When everyone follows the same approved procedure, there's less chance of accidentally violating a regulation.
So it standardizes compliance, in a way.
Exactly. And the SOPs themselves are the proof. They show regulators, look, we have defined processes for this, compliant with your rules. For high-risk things, like sterilization, having and following that SOP is often a direct requirement. It mitigates risk.
And it helps with audits, like you said, the paper trail.
Absolutely. Auditors love SOPs. It shows a structured approach to managing quality and compliance. There are also great training tools to keep staff current on regulations.
And they create accountability.
Yes, by clearly stating who does what, when, and how. Makes it easier to track responsibilities and address issues if they arise.
So how do organizations make sure their SOPs are hitting those compliance marks?
Well, start by really understanding the regulations that apply. Maybe get regulatory experts involved. Then, customize SOPs. Don't just use generic templates. Make them fit your specific situation.
Tailor them.
Right. Keep them updated as regulations change. Get employee feedback. They often see compliance issues on the ground. And maybe use specific compliance management software to help track everything.
Okay, that makes a lot of sense. So, wrapping this all up, what are the main things you want our listener to take away about SOPs in healthcare?
I think the biggest thing is that they're not just documents. They're foundational. Foundational for quality, for safety, for efficiency, and definitely for compliance.
It's not just about writing things down, it's a whole system.
Exactly. A system that needs careful thought and development, real effort in implementation and training, and ongoing attention through reviews and updates.
Hopefully this deep dive, using the resources you shared, has given you that clear overview, that shortcut to understanding why SOPs are so vital.
We hope so. It's a crucial piece of the healthcare puzzle.
So here's something to think about. Consider the important processes where you work healthcare or not. Are they clearly documented? Are they followed consistently by everyone?
And maybe ask, what's one small step you could take, even tomorrow, to improve the standardization of just one of those key procedures?
What difference could that small change make to how things run, to the outcomes? Definitely something worth pondering. Thanks for joining us for this deep dive.